We're evaluating qualified clinical data registries versus qualified registries, QCDRs versus QRs. Will QCDRs continue with MVPs as well as QRs?
Great question, Becky, and timely considering that this year, 2023, is the first year the MVPs are available. My answer with one disclaimer is yes. The disclaimer is it's hazardous to make any confident predictions of future Medicare actions or policies. They do have an inclination to surprise us. But with everything I see, you can expect both qualified clinical data registries and qualified registries to continue to serve MVPs. In fact, all existing quality submission mechanisms are represented in the 12 MVPs available for 2023, the first year of MVPs. Medicare has aggressive plans to continue to build out MVP measures and groups. To me, that means they're going to have to continue to aggressively seek out and offer measure choices from all the available solutions. To remind you about MVPs, MVP users have to choose 4 of the quality measures available in their chosen MVP. MVPs average about 10 available measures, with a range each of a minimum of 7 and at most 14 measures in the MVP. MIPS CQMs that can be offered by both QCDRs and QRs are by far the most commonly available measures. They average 7 MIPS CQM measures per MVP with at least 4 and at most 12 choices per MVP. Most qualified registries offer any of the available MIPS CQMs. QCDRs tend to be specialty specific. Medicare permits them to submit MIPS CQMs as well as their QCDR measures, and most will offer the MIPS CQM measures that are wanted and needed by the specialty they serve. The second most common mechanism is ECQMs. 2 MVPs have no ECQM choices. The average is 3 and the range is up to 8. In third place comes Medicare Part B claims. You may remember Part B claims as requiring fake CPT codes called QDC or quality data codes. These can only be used by small practices. That's those with 15 or fewer clinicians. 10 of the 12 MVPs have claims measure choices attached to them. There's an average of 2 choices per measure with a range from 0 to 6. If you're a small practice choosing claims measures, you don't have to submit a full complement of 4 measures if you submit all of the claims choices in your selected MVP. In fourth place is QCDR measures. 6 MVPs include QCDR choices. 6 have none. There's an average of 2 per MVP, and one of the MVPs has 6 QCDR measure choices. CAP survey is an available choice in 4 of the MVPs. Even administrative claims are represented amongst the MVP quality measure choices. Medicare calculates administrative claims measures from practice claims submitted for billing. Unlike the Part B claims measures, administrative claims don't require any unusual or fake entries in order to calculate the measures. It all comes from the existing CPT and diagnosis codes that are commonly included on a claims submission. 2 MVPs each include 1 administrative claims measure. So I hope this answers your question, Becky, and provides an introduction to the MVPs for our other listeners.